Knee pain can come in a few different places, and the key thing in trying to determine what's causing it and how to treat it is very thorough history with the patient, very good assessment and exam. And also, one of the key things we ask is, where does the knee actually hurt? And a lot of times, if the knee hurts on the backside and is predominantly on the backside, we know there's a good chance that the knee pain actually isn't coming from the knee, and a lot of times that pain can be coming from the low back. So if that's the case, and we determine that's the case, and that's what we do our first visit or so, this is a little bit of what treatment for that will look like. If it is a lumbar issue, we will get in there and make sure that the low back joints are moving well. To do that, that comes with the chiropractic adjustment. I'm going to bring you forward a little bit. Into the low back, just like that. And from there, we then exercise the low back by what's called in-range loading. Or in this case, we're going to do repeated in-range loading for extension. So we're going to, in this case, do the world's laziest push-up, as I like to call it. We're going to lay face down on your stomach, go arms out by your side in push-up position. Keeping your whole lower half relaxed, we're going to use the arms to really exercise and move the low back to its furthest in range of extension that we can. So we're going to push the shoulders and chest away from the table up as high as you can. Get the arms locked all the way out. From there, come right back down. And this is how they treat themselves at home for their knee pain, by doing this exercise to the low back over and over and over throughout the day. Sometimes the back needs to move the opposite way, and that is what we also determine at the first visit is, do we need to move the back more for extension with the world's laziest push-up, or do we need to move the low back more into flexion with what's called repeated low back flexion and lying? So in this case, going to bring both knees up towards your shoulders, reach down, grab your knees, pull them up as tight as you can. Good, straighten your arms back out so your knees come back to there, and repeat. Pull the knees up a little bit higher and a little bit tighter each time. We determine, and we do a lot of test movements like this to determine which one of these is going to, one, help increase the motion in the low back, and two, decrease the pain in the back of the knee. Like I said, this is for specific pain that stays in the back of the knee typically. And the right exercise is a little bit of an experiment and a little bit of art and a little bit of practice.